vaccines. So I think get on main topic. I think we have to understand that a lot of people here are part of an echo chamber, if you like, right? A lot of us are already kind of converted, if you like, to the more truthful message. But the real challenge we have is how do we break through that message to people who are not already on our side, if you like, who are not open or haven't been exposed to the truthful message. So there are three psychological phenomena I think we need to understand and appreciate if we are going to break through. The first one is a willful blindness. So that is when humans, and we're all capable of this, by the way, in different circumstances. So this is when human beings turn a blind eye to the truth in order to feel safe, in order to protect prestige, avoid conflict, and reduce anxiety. That's the first thing. So that's willful blindness. And we have many historical examples of this happening throughout history. The second phenomenon is one of fear. Many people are still gripped by fear from the COVID pandemic, almost a form of PTSD, if you like. And the problem with fear clouds our ability to engage in critical thinking. Even the brightest minds can be affected by this. And the third phenomenon, which I think applies in many ways to policymakers and academics, is that changing one's mind can be one of the most terrifying experiences a human being can go through. You know, the Canadian-American economist John Kenneth Galbraith said that faced with the choice between changing one's mind and proving there's no reason to do so, almost everybody gets busy on the proof. But accepting and understanding these facts, I think, allows people and opens them up to maybe being more in terms of the way we communicate it, but also in terms of the way they receive. And of course, the late great Stephen Hawking actually said, in fact, this is actually an evolution. This is a thought of the Buddha. You know, I'm a big follower of the Buddha in recent years. I've become very spiritual. What's worse than ignorance? The illusion of knowledge. Okay, so now I know the WHO aren't necessarily in the good books of this organization today, and they have done a lot of things wrong, but one of the things I do really appreciate is their definition of health. So when we talk about the bigger picture of what we're dealing with here, you know, that definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. How do we achieve that? Well, I'm going to talk you through a little bit of the findings which I published in the Journal of Insulin Resistance. But to start off with, as a doctor, my primary purpose is to improve my patients. That means managing risks, treating illness, and last but not least, relieving suffering. Everything I do as a doctor is predicated on that principle. And how do you? It's a very elegant analytical framework that is now more than 25 years old. Unfortunately, is not being implemented in the way it should be. We do this from our clinical experience, our clinical intuition, our knowledge as doctors, using the best available evidence. And last but not least, in fact, the most important, is taking into consideration individual patient preferences and values. Because if you don't do that, whatever you suggest is not. You'll get non-compliance. You have patients, and this is informed consent. So the problem is this. Evidence-based medicine has become an illusion. Evidence-based medicine has been hijacked by very powerful vested interests. And as a result, we have a complete healthcare system failure. And I would say a pandemic of misinformed doctors and misinformed and uninformed patients. Based upon a number of factors. I'm an evidence-based guy. I love mathematics. I love numbers. I'm a root cause analysis guy. So let's go through these, right? What are the problems with the best available evidence? Because if a doctor is making clinical decisions on commercially biased or corrupted information, at best it's going to do suboptimal outcomes for our patients, and at worst it's going to do harm, and that's where we're at. So what are these factors? Well, biased funding. That's research that's funded because it's likely to be profitable, not beneficial for patients. Biased reporting in medical journals, biased patient pamphlets, biased reporting in the media, we'll come on to that later. Commercial conflicts of interest, defensive medicine, and last but not least, medical curricula that fail to teach doctors how to comprehend and communicate health statistics. Without understanding the numbers involved, doctors, patients, and members of the public are vulnerable to exploitation of their hopes and fears by commercial and political interests. Let's break down the numbers. That's so important. Let's break it down in a way that people can understand. So John Ioannidis, I describe as a Stephen Hawking-like figure in medicine. He's a professor of medicine and epidemiology and statistics at the University of Stanford. He's the most cited medical scientist in the world. And in this paper, which is called How to Survive Medical Misinformation Mess, he describes that 30 to 50% of all healthcare activity in the United States brings no benefit to the patients, and that most doctors are unaware of all of the poor quality research that contributes to overuse of medications, underuse of safer, cheaper options, and even lifestyle interventions, waste, missed opportunities for right care, and avoidable adverse events. And these are the main factors behind it, right? So this is an important thing that people need to understand. Everybody needs to know this. Much published research is not reliable, offers no benefit to patients, and is not useful to decision makers. Most healthcare professionals are not aware of this problem. Most doctors don't know these failings in the system that contribute to their clinical decision making. They then lack the necessary skills to evaluate the reliability and usefulness of medical science. And then last but not least, again, patients and families then lack relevant, accurate medical evidence and skilled guidance at the time of medical decision making. Now, ignorance of this problem, even at the highest levels of academic and clinical leadership, is profound. Peter mentioned earlier, referenced the former director of the CDC, Rochelle Walensky, who said that her optimism from the vaccine, COVID-19 vaccine, came from CNN. The CNN news report, where her optimism came, was almost verbatim reproduction of Pfizer's press release. Think about that. My own experience, I gave a talk last year at the British Medical Association conference at one of their meetings. One of the attendees was the chair of the British Medical Association, Dr. Chan Nagpur. He was shocked and couldn't believe when I told him that our regulator in the UK, our medical regulator, gets most of its funding from pharma. He didn't know that. When I spoke to him, when I was campaigning to overturn vaccine mandates for healthcare staff, I spent 2 hours, a very open guy. He said to me, Aseem, and from everyone I've spoken to, including people like the chief medical officer and health policy makers, he said, nobody appears to have critically appraised the evidence as well as you have. Most of these people are getting their information from the BBC. Now, another thing that John Ioannidis, he is a great mathematician, he's a statistician. One of his calculations, he wrote this paper in PLOS One in 2001. It said why most published research findings are false. In other words, certainly when there is commercial interest involved, those publications, which is most of drug industry sponsored research, the conclusions exaggerate the safety and benefit of their interventions, okay? And he says the greater the financial or other interests and prejudices in a scientific field, the less likely the research findings are to be true. So I've been campaigning on this for many, many years. I spoke in the European Parliament in 2018, and I made some clear, some very key points there. I think that people, again, need to appreciate when we look at the root cause of the problem. The pharmaceutical industry have a legal obligation to produce profit for their shareholders. They do not have a legal requirement to give you the best treatment. But the real scandals are these. The regulators fail to prevent misconduct by industry, and that doctors, academic institutions, and medical journals that have a responsibility to patients and scientific integrity collude with industry for financial gain. And I said the situation has become so dire, the honest doctors can no longer practice honest medicine. Now, let's give you some brief history of the pharmaceutical industry, because that's where we're going here in terms of root cause of the problem. So there's extensive research and evidence on fraud committed by the pharmaceutical industry. Most of the top 10 drug companies, certainly between 2009 and 2014, were found to have committed fraud in the United States, totaling about $14 billion in fines for illegal marketing of drugs, hiding data on harms, manipulation of results, for example. And Peter Gosha, the co-founder of the Cochrane collaboration, says the situation is not resolving itself, because what happens is the fines are so small they end up making more profit from the drugs that they've illegally marketed, right? So the crime is essentially paying. And he said, we need to create a situation where the fines are so large that drug companies risk going bankrupt, and that senior executives involved in these frauds need to go to jail, right? And that will act as an effective deterrent. People, let's play devil's advocate here, but Dr. Malhotra, isn't the drug company responsible for saving so many lives, et cetera, et cetera? Yes, there are many drugs that have been produced by the pharmaceutical industry that are life-saving and beneficial in the right patient, okay? But what is the net effect of these drug companies, certainly the last couple of decades? This is one analysis done in France between 2002 and 2011. Almost 1,000 drugs were approved by their regulator. Most of the drugs were copies of old ones. So they change a few molecules here and there. They patent these drugs, huge waste in the system. The taxpayer, we pay for this, okay? And then when they looked at harmful drugs versus, clinically therapeutic drugs that were, new, innovative, double the amount of drugs that were found to be more harmful than beneficial. So 15.6% of the drugs were found to be more harmful than beneficial, and over 8% that were thought to be of therapeutic value. So what do we conclude by this? The overall, and this has been repeated everywhere, this has been repeated in the United States. Marcy Angel, former editor of the New England Journal of Medicine, considered the most high-impact medical journal in the world. She did her own analysis saying that 75% of drugs in the US are found to be copies of old ones. One of the reasons for this is drug companies now spend 20 times more on marketing than they do on basic science research. So the system is not even encouraging good innovation. The system is rigged against the population, against innovation, but for the profits of these big companies. And Marcy Angel says, it is no longer possible to trust much of the clinical research that's published or to rely on the judgment of trusted physicians or authorities of medical guidelines. And she reluctantly reached this conclusion over almost 2 decades as an editor of the New England Journal of Medicine. She's not alone. Richard Horton, editor of The Lancet, he came to one of my recent talks recently. I'll tell you about that later. And I cited him in my talk, and he said, in his editorial in 2015, he said possibly half of the medical published literature may simply be untrue. Right? This is not conspiracy theories here. These are people at the very cutting edge. These are leading medical journal editors who are saying this, and it fits with the data, right? And of course, there's a big problem in British institutions of research misconduct. Richard Smith, former editor of the BMJ, in a meeting that in a talk he gave to some leading academics in the UK, he asked the audience of academics. He said, "How many of you are aware of fraud or manipulation of data taking place in your own department?" Right? And these are some of the most prestigious British institutions. A third of the audience put their hand up. He said, "How many of you have reported it?" They all put their hand down. Right? This is a cultural problem. And again, I'm going to the roots of that cultural problem too. One example, which I still find quite shocking, of research misconduct. Now, you want to understand, this isn't all about money. For academics, there is a pressure to publish, there is a power and prestige that comes with publications. And one of the most egregious examples was a Dutch researcher was fired in Holland from his job for committing fraud. He basically published lots of papers on the use of beta blocker drugs in non-cardiac surgery that influenced European Society Cardiology guidelines. And it's estimated that his fraud was responsible for 800,000 excess deaths across Europe. That's one person in one situation where this was determined.